If you want to banish your bloat, you need to figure out the specific reason why you're bloated in the first place so that you can apply a specific solution. And keep in mind, there could be multiple reasons and multiple solutions. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, bloating is one of the commonest problems I deal with as a gastroenterologist. And the most important thing for you to know is that there is no one-size-fits-all solution when it comes to bloating. In fact, the title of my third book, The Bloat Cure, 101 Natural Solutions for Real and Lasting Relief, talks about 101 different natural solutions because there truly are so many different things that can make you bloated. We are not going to go over all 101 today, although if you're interested, I highly recommend you check out the book, The Bloat Cure. But today, I'm going to tell you about 10 of the most common causes of bloating. And I want to get you thinking about categories because that really is the key to banishing your bloat. You need to figure out, is this a food problem? Or is it an anatomical problem? Or is it a medicine cabinet problem? And of course, your bloating could be caused by more than one category. It could be a food problem plus a medicine cabinet problem. To be a successful medical detective when it comes to bloating, to figure out the root cause, and most importantly, to make sure you get lasting relief, it's really helpful to think in terms of these categories. So today, I'm going to be covering 5 of the big ones, and that is going to include medicine cabinet, food, habits, hormones, and anatomy. Now, keep in mind, these are not the only categories or causes. There's plenty more. There are conditions like diverticulosis and fibroids and Hashimoto's thyroiditis and so many more causes to talk about. But my goal on the podcast today is to highlight some of the common ones and really to get you thinking about what categories may be the culprit when it comes to your bloating. If you want the full Monty, all 101 causes and solutions, definitely check out the book, The Bloat Cure. When we come back, let's dive right into those top 10 causes. The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. The first category I want to talk about is the medicine cabinet. And the first item in the medicine cabinet are antibiotics. When you take an antibiotic, you may experience symptoms like nausea or diarrhea after a couple of doses, but you may not realize that your long-term bloating could also be a direct result of those antibiotics. And not just antibiotics you took recently. It could be a result of antibiotics you took years or even decades ago. Antibiotics are supposed to kill pathogens, and they often do that very well, but they also indiscriminately kill off huge numbers of the good bacteria in your gut that are essential for a healthy digestive system. And what happens is that undesirable gas-producing microbes multiply and fill the void created by the loss of the good bacteria. And even benign bacteria, if their numbers increase too much, can become problematic. The end result is dysbiosis, a state of bacterial imbalance and one of the most common causes of bloating. Second in the medicine cabinet, proton pump inhibitors. These are acid-suppressing drugs, and if you've been taking one of these medications for more than a few months, it could be the reason you're bloated, especially if you're having lots of indigestion and gas after eating. Stomach acid is an essential ingredient in digestion. It is arguably the most important ingredient in digestion. And when you block stomach acid, as these proton pump inhibitors so effectively do, you create maldigestion, And you also interfere with the natural gradient of bacteria in your gut. And these two things can result in major bloating. Moving on to another big category, food. And this is a huge category. There are multiple things in this category, but I want to talk about two that are often overlooked and that are really ubiquitous in our diet. And the first is artificial sweeteners. And I can't call artificial sweeteners food because they are really not food. They are non-nutritive, meaning they're not supplying any nutrients, edible food-like substances. And they're a super common cause of bloating because they are not absorbed in your small intestine, where most of the food is absorbed, and they end up traveling down to your colon, where they get fermented by colonic bacteria, and that can result in lots of gas. Studies also show that artificial sweeteners are harmful to your gut bacteria, and they can disturb that delicate balance between good and bad bacteria that's an important part of staying bloat-free. Second in the food category, soy. If you are lactose intolerant, like more than 50% of the world's population, a soy latte may seem like a great idea, but processed soy can be a big contributor to bloating. Small amounts of unprocessed fermented soy, like miso, natto, and tempeh, can have some health benefits, and they can actually encourage the growth of beneficial bacteria. But large amounts of processed, unfermented soy that we often consume in place of dairy, or it's used as filler in the food industry, particularly in processed foods, that can have the opposite result. Too much processed soy can also contribute to something called estrogen dominance that I'm going to be discussing in a minute. And it can also affect thyroid function in some people, which is also a major contributor to bloating. When we come back, habits, hormones, and anatomy. Okay, so we've talked about two of the big categories, and that includes the medicine cabinet and food. Let us talk now about habits and lifestyle things that can cause bloating. And the first thing I want to talk about is a condition called aerophagia, which means swallowing air. And it's something that a lot of people have and don't realize it, and it can make you go up a couple pant sizes within 24 hours. Now, it's normal to swallow a little air when you eat or drink, especially if you are consuming, for example, carbonated beverages like seltzer or champagne or beer. But as the day progresses, if you are feeling like the Michelin man or woman and you really just want to pop your belly with a pin to try and deflate it, if you find that you're having this incredible distension that just increases throughout the day, you may be swallowing large amounts of air on a regular basis. And again, a condition we call aerophagia. And aerophagia can lead to a massive buildup of gas in your gastrointestinal tract, and it can cause major bloating. It's incredibly common. It's also very underdiagnosed. Most people with aerophagia complain of three symptoms: bloating, burping, and abdominal distension. If you have chronic sinus problems, if you have a deviated septum, if you have a history of allergies or asthma, you may be a mouth breather rather than a nose breather, and mouth breathing predisposes you to aerophagia. Other habits that can lead to aerophagia include chewing gum, sucking on hard candy, smoking, eating too quickly, talking when you're eating, drinking lots of liquids with your meals, or holding your breath when you're anxious. That's something that lots of people do. And those are all things that can cause aerophagia. Second thing in this sort of lifestyle habit category is late night eating. You may not realize that your digestive tract has a bedtime. The muscular contractions of your digestive system are tied to the light-dark cycle, known as the circadian rhythm. So your GI tract is most active during the day and least active at night. And that is when you are probably consuming the majority of your calories, at night after the sun has set. And to make matters worse, many of us, after filling our sleepy stomachs with food at night, are reclining on the sofa or in bed. So we are missing out on the benefit of gravity and movement, two important factors to help transport things from north to south in our digestive tract. Eating large meals at night is a sure way to feel bloated, and it can also cause or exacerbate acid reflux. Another big category, hormones. And the first one I want to talk about there is something called estrogen dominance. I referred to it earlier in the podcast. As you approach menopause, your levels of both progesterone and estrogen start to decline. But progesterone decreases more than estrogen, leading to a state of estrogen dominance. And this is a condition that is highly correlated with bloating. Exposure to xenoestrogens, which are compounds that are produced outside the body but have an estrogen-like effect, those compounds can also contribute to estrogen dominance. Xenoestrogens are widespread in our environment. They are in hormones that are given to many commercially raised animals. They are in pesticides, and they're in a lot of the plastics and chemicals in everyday use. They're in some dry cleaning fluids. If you are significantly overweight, you may be more likely to experience estrogen dominance because androstenedione, a hormone that is made in the male and female reproductive organs, in the testes in men and in the ovaries in women, and is also made in the adrenal glands, that hormone gets converted to estrogen by fat cells. So this is something that both men and women who are significantly overweight or have obesity can suffer from. In addition, if you are taking birth control pills or on hormone replacement therapy, you are also exposed to estrogens because those are forms of xenoestrogens, and they can also be a major cause of bloating in some people. The other thing I want to talk about in the hormone category is stress. Stress can worsen virtually every digestive condition, and it is associated with an increase in certain hormones, particularly cortisol. Stress can also significantly worsen or cause bloating. So how does it do that? Stress disrupts the normal hormonal messaging that normally happens in your gut. And those hormonal messages are really important for maintaining bowel regularity. Stress can lead to an increase in stomach acid. It can shunt blood away from your intestines because instead of being in rest and digest, you're now in fight or flight. It can decrease enzyme secretion, and it can slow down your stomach emptying. And those are all things that can add up to some serious bloating. Stress also creates changes in your gut that can affect your immune system. Things like an increase in intestinal permeability that's associated with leaky gut and food allergies. It can create greater susceptibility to inflammation and infection and overgrowth of harmful bacteria. If you think you may be anxious or overly stressed, it's a good idea, obviously, to have your mental health assessed by a professional, especially if you've been diagnosed with irritable bowel syndrome, IBS, and you have been told or it's been suggested to you that stress is partly to blame. Because not feeling well psychologically makes it much more challenging for you to have a healthy, bloat-free digestive system. Coming up, the last and probably the most important category, your anatomy. Our final category is anatomy and physiology. And the number one cause of bloating there, the voluptuous venous colon. There are three big differences between the male and female colon that explain why bloating tends to be such a big problem for women. The first difference is that women have longer colons than men, on average about 4 to 5 inches longer. And that may not seem like a lot, but it translates into lots of extra twists and turns in the colon. And in the medical literature, this sort of twisty-turny female colon is often described as redundant or tortuous or spastic. I prefer to think of it as a voluptuous venous colon, but unfortunately, giving it a nicer name does not prevent the products of digestion from getting stuck in all those twists and turns, and that can lead to lots of gas and bloating. The second difference is that women have a wider, deeper pelvis than men. And that causes the colon in women to drop down into the pelvis, where it competes for space with the uterus, the ovaries, the fallopian tubes, the bladder. And the result is lots of looping and crowding and constipation and bloating. In men, their reproductive organs take up much less space in their pelvis, so they are much less likely to suffer from bloating because there is not this competition for space. The third difference is hormone levels. Men have higher levels of testosterone. We as women also have testosterone, but we don't have as much. And testosterone makes men more muscular overall, including giving them a tighter, more well-developed abdominal wall. So it's sort of like a built-in Spanx. And we have a Spanx too, but ours tends to be a little more stretched out because of the lower testosterone levels. And so as a result of this, there is less tendency in men for their colon to form loops and protrude, and that protrusion is often experienced as bloating. Overweight men may complain of a bare belly, but they rarely complain of being bloated because underneath all that belly fat is a nice, tight abdominal wall. I want you to keep in mind that men can have a voluptuous venous colon also, despite these sort of typical male-female differences. Check out episode 3 of the Gut Bliss podcast on the voluptuous venous colon. I did a whole episode on it if you want to get plenty of solutions for how to decompress your curvy colon. The final thing I want to talk about in this anatomy physiology category is belly fat. And I save this for the end because there are some important medical repercussions of belly fat. And it's also, sometimes really difficult when somebody comes to see me about bloating and I have to break it to them that they're not really bloated, they have belly fat. So the burning question, how can you distinguish between bloating and belly fat? Really important. Bloating is usually caused by gas. It can be caused by liquid and even by solid stuff like stool, but it generally ebbs and flows. This is really important. Some mornings you are flat as a pancake, and then by dinner time, you look 6 months pregnant. Or things are fine for a few days, but then you have, several days when you can't button your pants. So for most people, there is a lot of variation in their bloating. Whereas with belly fat, you never really deflate. You are just consistently distended. If you're not sure whether your bulge is bloat or belly fat, here's what I want you to do. I want you to take a tape measure and measure around your waist at the very same spot. I generally recommend right around the belly button, and measure first thing in the morning and at bedtime every day for a week. If you are bloated, you will typically see that the number varies quite a bit, the number from morning to bedtime and also from different days. If it's belly fat, that measurement generally doesn't change by more than an inch. While you have the measuring tape out, I want you to use it to measure another super important number, and that is your waist to height ratio, also known as the index of central obesity. You absolutely need to know this number, and here is why. If your waist circumference is more than half your height, even if you're not overweight, you are more likely to have something called metabolic syndrome. And that is a deadly combination of risk factors that's present in up to 25% of Americans. Why is it so deadly? Because having metabolic syndrome dramatically increases your chances of developing heart disease, stroke, diabetes, and some types of cancer. So what are these risk factors? They include high blood pressure, high fasting blood sugar, low levels of HDL, which is a good cholesterol, elevated triglycerides, and an increased waist circumference. Again, a waist circumference that is more than half your height. And this is a type of bloating that can be deadly if not addressed. So on that somewhat somber note, I want to leave you with 3 takeaways that can help you figure out why you're bloated and get you to the right solution. Number 1, I want you to become a medical detective by thinking about categories for what's causing your bloating. Is this an anatomical problem because you were recently diagnosed with fibroids? Is it a food problem that's caused by the soy milk you're putting in your oatmeal every morning? Number 2, your bloating may be caused by more than one thing, and that means it may require more than one solution. It may require a dietary change, plus a lifestyle change, or it may even require some form of medical intervention if this is an anatomical problem, for example, that needs to be addressed. And number 3, Do not accept the idea that you're bloated and that this is just normal and this is the way things are. Even if there's not anything seriously wrong, that still doesn't mean everything is right. Bloating is important feedback that your digestive tract is giving you, and you need to work to figure out why, rather than just accepting this as a status quo for your body. So that's it for this edition of the Gut Bliss podcast on top 10 causes of bloating. If you want to go both deep and wide into all the different causes of bloating, plus get detailed solutions, check out my book, The Bloat Cure, 101 Natural Solutions for Real and Lasting Relief. Coming up next week on the Gut Bliss podcast, uninvited guests. Could a parasite be the cause of your digestive distress? Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.